I bet you've never been taught to transfer a patient safely. In this video, I'll tell you 3 things that you need to have to perform a safe transfer. The first equipment you must have is a portable suction unit. If the patient vomits or has any fluid that obstructs the airway during the transfer, the patient will have a respiratory arrest before you have time to reach the next place of safety. Trying to turn the patient to their side may not be feasible because of patient factors, because you don't have enough hands, and also it's difficult to do when the trolley is moving. The suction catheter unit allows you to clear the airway whilst you're moving, gets you a temporarily patent airway, and allows you to reach the next place of safety. The second set of equipment that you must have is an oxygen cylinder and a back valve mask. If, for whatever the reason, the patient is unable to breathe spontaneously during the transfer, you are able to manually ventilate the patient until you reach the next place of safety. The third thing that you need is a knowledge of the places of safety along your route of transfer. Such places include the emergency department, the critical care unit, high dependency unit, and anesthetic theatres. You should have a plan in your mind of which place of safety you will divert to if your patient deteriorates at any point of your transfer. For example, if you're transferring a patient from the ward to the radiology department and the patient deteriorates in the second part of your transfer, your place of safety is the emergency department, as it is the closest place of safety. And if the patient deteriorates in the third part of your route, you will divert to the theatres, as this is your closest place of safety at that point in time. These are the 3 bare minimum things you need for a safe transfer. You might need to bring other forms of equipment and medication depending on your patient, but this is out with the scope of this video. Intra-hospital transfer risks are always underestimated. You're in a corridor or lift with no personnel, no equipment, and no forms of communication to call for help if your patient deteriorates. If you want to learn more about how to transfer a patient safely, I'd suggest that you speak to your local anaesthetist, intensivist, or even take a course on how to transfer a patient. If you have found this video useful, please consider sharing this video with other doctors or nurses. Please stay tuned and follow for more. I hope that helps.